Let's be honest, there is almost nothing more terrifying than seeing a child who can't breathe. So today, we're going to talk about what to do in that moment. We're diving into pediatric respiratory distress, and specifically, its #1 cause, croup.
So, picture it. A child is really struggling, gasping for every single breath. It's so easy for panic to just take over, right? But in these moments, the single most powerful thing you can have is knowledge. Just understanding what's going on is the first, crucial step to taking the right action.
So I'll ask you straight up, if you were there right now, would you know what to listen for? Because the sounds a child makes when they're in distress, well, they aren't just noise. They're clues. They're vital clues telling you exactly where the problem is and just how serious it might be.
And that brings us to the first skill you absolutely need, listening. A child's airway, it's telling a story. And the two most important words in that story, wheezing and stridor. You know, they might sound kind of similar in a scary moment, but they point to two completely different problems.
Okay, first up is wheezing. This is that high-pitched, kind of musical whistling sound. If you've ever been around someone with asthma, you know what I'm talking about. It happens when they're breathing out, and it's because the small, lower airways, way down deep in the lungs, are getting squeezed.
Now let's compare that to stridor. Stridor is not a whistle. Oh no, it is a harsh, loud, almost like a crowing sound. It's caused by a blockage way up high, think throat, voice box, windpipe area. And you're usually going to hear this sound when the child is breathing in. Big difference.
So here's the bottom line, the main thing to remember. Wheezing means the problem is down low, in the lungs. Stridor means the problem is up high, in the throat or neck. Being able to tell those two apart is the first, most critical step in figuring out what to do next. And I want to be crystal clear about how serious stridor is. This isn't just my opinion. The medical guidelines are really direct on this. This quote says it all, right? Stridor is not a wait-and-see kind of thing. It always means you need to get help immediately, because it could be a sign that the airway is closing. Okay, so if stridor is this huge red flag, what's usually causing it? Well, that brings us right to our main topic, croup. It's the most common culprit, so let's break down what this illness is all about.
Just how common are we talking? Well, for kids between 1 and 2 years old, about 60 out of every 1,000 will get croup. That's a lot. It pretty much disappears after age 6, but man, in those toddler years, it is a huge cause of breathing problems.
The thing about croup is that it often starts out looking like just a normal cold, a hoarse voice, a runny nose. But as that upper airway starts to swell and get blocked, you'll start to see more. They'll breathe faster, their nostrils might flare out with each breath, and then you see the really big one, chest wall retractions. That's where the skin actually sucks in around their neck or between their ribs every time they try to take a breath. And because the symptoms can get worse over time, doctors actually grade how severe the croup is. It's really important because not every case is a 5-alarm fire. This grading system helps everyone figure out just how blocked that airway really is. So let's just walk through how this gets worse. At grade 1, or mild croup, you only hear that stridor sound when the kid is crying or running around. At grade 2, moderate, you hear it even when they're just sitting there, calm. But grade 3 is where the alarm bells really go off. That's when you see the stridor and those chest retractions when they're at rest. And grade 4, well, grade 4 is a true medical emergency. The child is exhausted and their skin might look pale or even bluish. Okay, so you've recognized the signs of severe grade 3 or 4 croup. This is go time. What happens now? The immediate goal is to get that swelling in the upper airway down and open things up so they can breathe. In the hospital, for these really bad cases, one of the first things they'll do is give nebulized epinephrine. It's basically a medicine that they turn into a mist, and the child just breathes it in. It works incredibly fast to shrink that swelling in the airway, which can make breathing so much easier so quickly. But wait, there is one more absolutely critical question you have to ask. Did these symptoms come out of nowhere? Like, was the child perfectly fine 1 second, and then choking and making that stridor sound the next? If so, you have to think about something else. They might have breathed in a small object. Getting the story of how it started is so important for telling the difference. And really, that brings us to the most important point of all of this. This isn't about you becoming a doctor. It's about you being able to spot the danger. Recognizing that harsh, crowing sound of stridor and knowing what it means, that can, and I mean this quite literally, be the thing that saves a child's life. So, I'll leave you with this one last thought.
We've talked about wheezing, we've talked about the different grades of croup. After all of this, what is the one single sign of respiratory distress that you will now never, ever ignore? Because remembering that answer, that could make all the difference.